Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 7021 Village Parkway, Dublin, California 94568. My phone number is 408-687-1899. Email address homeomedicine@yahoo.com. Anytime, at any age, for any disease, when you are tired of any treatment, please call me for your second opinion of your disease. Or if ever you want to be treated with the scientific homeopathic treatment for your disease, call 408 687 1899. There is no consultation fee, just medicinal charges. If ever you want to go through with the homeopathic treatment or you want to take homeopathic medicines, you can call this phone number 408-687-1899. As you know, we have started a series of lectures of health education, and health education is dealing with the life, and the life, how it was created, started, how it was structured, how it came into existence physically, and then the physical development, how this physical development of our body takes part, develops in the mother's womb. All that has been described in all these lectures systematically. How he passed his time in the mother's womb, and also and also in this way, uh, what are the problems he faced in the mother's womb. Also, the problems of the female who was pregnant, who was just helping for the development of the new life and structure of the body. At that time, she suffered a lot because of the problems she faced. And we have discussed one by one all those problems in these series of lectures. And after that, who helped also, who helped this new life to develop in a normal way, we have discussed all those points. After that, we have discussed that the problems of the fetus, which is in the mother's womb, even these problems starts not only in the fetus stage, but also in the embryo stage. Embryo state is from this very beginning of the formation of this new life, that is blastocyst, and up to the 12th week of the pregnancy, means 3 months. Up to the 3 months of pregnancy, it is considered embryo, and after that, it is known as a fetus. The name is changed because of the development it shows till that. And what are the complications at this time during this life in the mother's womb, about for 280 days, what type of complication he has to face structurally, mentally, or every development phase. We have already discussed all those things. Some of the complications we have discussed, which are already covered with the passage of time, and some of the complications we discussed that these are not covered even after the delivery. Even after the delivery of the child, and some of the problems which are covered after a short while of the delivery. In this way, uh, In this way, we have discussed the possible course of the fetus in the mother's womb. Now, we are at the stage that the time has come when this child, when this fetus has to come out of mother. And it's natural fact. It's a natural fact. It has to, just like the even the prinde, all those animals, and and they give birth to the children, and then they push them out for their own individual life. And this is what happening with us. We are a little different from that, but even then, this is the first instance that now, after developing normally in the mother's womb, this fetus has to come up. And what causes this fetus to come out when he was living normally? Though it's a natural fact, it's a natural fact. And I will describe you the reasons behind this one, this feature that is known as the labor pain. Mostly, the labor pain is considered with few factors. Some of the factors we will discuss over here, which are very possible, and you can understand them easily. That what are the possible factors which initiate the labor pains. Otherwise, the child can remain may continue to remaining inside the mother's womb safely, was not doing anything, just playing, and living normally, and the mother was supplying the food to him. But you might have heard about the ecosystem of the nature that changes. In other words, in a short language, I can describe why peoples are migrating from one place to the other, why peoples are migrating from India to America or Canada or to various other countries. Why? Because their grievances are not fulfilled over there where they are living, whatever their grievances. And for the better life and for the achievements, they migrate from there. Same way, nature does in its environment changes time to time. And not only the environmental changes, with the environmental changes, the animals and other living products, they also change their places because of better food, because of better environment, because of suitable environments, and they go from one place to the other. And the nature maintains a balance in that. And that balance is known as ecosystem. Something will go from one place to the other place, will migrate, and something will come up over that place. Just like, it's a joking, but it's a reality. Just like the persons from the UP and Bihar, they are coming to Punjab, and people of Punjab, they are migrating to other countries. UP Bihar peoples, they are thinking that there is a better life in Punjab. And the Punjabis who are living, born over there and developed over there, they think, no, this is not the life. We should find out some other good places. And for the development of life, we should do somewhere else, and we should migrate. And they migrate. And this migrations, from one place, the migration goes to the other place, and some of them comes to fill up the gap. And that is known as ecosystem. And I have told you, ecosystem is not only the environment. Ecosystem is of the products, means animals, all those peoples, even the minerals, metals, whatever is there. That also, though it migrates in a short, in limited places, but they migrates. Many of the Indian trees are now growing in America or Canada. Many of the fruits or all these things which were growing in the India, now they are growing here. So means with the persons, many things move, many things migrates and starts developing over there. They accept the universal environment over there and dwell. Same thing. Now, our question is, why the labor pain starts? Labor pain is also a similar type of question of ecosystem. Now, the environment of the mother's womb inside the uterus is not suitable. He is not feeling, though it seems suitable, but it feels to him it's not suitable. It's not suitable, so he want to migrate from there. What is not suitable? Why it is not suitable? These are the questions. This is the especially for this lecture. Why it happened in this way? One thing, first of all, I will tell you, it is concerned with pain, laborious pain. And just like one time when I was discussing about the formation of the rectum and passing of the stool, I was telling you that everywhere nervous system goes to each cell of the body, and every nervous system which is being supplied to every cell of the body has two parts. One is the sensory part, and the other is the locomotory parts. Sensory parts means feel, realize what's going on over there, and locomotive parts what to do for them. If this is the environment, then what to do over there? The locomotive parts. And I told you, stool continuously is lodged into the rectum. And if throughout the portion of the rectum, about 24 inches, if centimeters, if there is a sensitive part, sensory fibers, then every time when the stool will drop, we eat 2 or 3 times, we eat even many times. Some of the snacks we take, and whenever we take, ultimately it's a full of intestines, and in the backside, when new things will come up, automatically the other thing has to go out. In the same way, whenever from the intestines stool goes to the rectum, a person should feel urge but to go to school, but we are not going. No, we are drinking, we are taking food, we are taking snacks, breakfast, lunch, dinner, whatever, many times, but we go only for 2 times maximum, morning and sometimes in the evening time. This is a normal factor. Why we do not feel? Because the rectum is continuously being filled with the stool. The peristaltic motion of the intestines are continued from mouth onward up to the anus. It's one link, and that link is continuously moving. And whatever goes at one time in the mouth, it should stimulate the function throughout the anus. But I told you, in the rectum, the sensory fibers are not stimulated, they are there. Just like sometimes you might have heard that a fast train is coming from one distance and going to the other distance, and there are some other station in between, and this train is not stopping over there. Either it's not taking passengers there, it is not dropping passengers over there. It means it is not taking the passengers over there, means it is not realizing that passengers are there, or the passengers are thinking that this train is not for us, we cannot take this train out from this stations, they have to go somewhere else. Same way, the stool is filled continuously into the rectum with each peristaltic motions. That is known as barborhythmy, and barborhythmy's duration is 5 seconds continuously. Ultimately, the rectum is filled. Then why you feel urge? When already it is dilating and there is a gap In front of the rectum, there is a Douglas pouch, I told you, a space, vacant space. And vacant space is when when the rectum dilates with more and more stool, it dilates. Fill up the space. Then why a person feels urge to go to school in the morning, stool in the morning time? Because just like you make a pillar, you make a pillar and you fix that this pillar can hold 2-story, 3-story, 4-story, whatever the strength of the pillar is. Same way, the recto-anal junction, where the rectum is attached to the anus. Anus is about 14 to 15 centimeter, and the rectum is about 24 centimeter. Means recto-anus junction, where these two portions, outer portion is the anus, and it is about 14 to 15 centimeters. And from that junction, the rectum goes upward up to sigmoid colon, and it is about 24 centimeters. Means their junction has sensory fibers over there. And these sensory fibers has their capacity to hold the weight. That how much weight they can hold. And when that weight comes, then you feel the urge. Those sensory fibers, locomotive fibers are passing through. The sensory fibers are passing through. But sensory fibers in the rectum, they are not sensing everything. That, oh, stool has come. Okay, go to the urge. No, sensory, they do not. They do not. They feel it at the end of the rectum where anus starts. And they are having a capacity that how much weight of the stool they can lodge, they can hold. And when the weight of the stool comes to that extent, then at that time, if person feels urge, sometimes people do not go to 2 days, 3 days, sometimes 7 days, they do not go. It depends upon that powerlessness of the sensory fibers. They do not do that. They do not realize that. Sometimes people do not feel that. But feeling urge but do not going is a locomotory function. But do not feeling, even eating parathas and everything, and do not feeling to go to urge, to go to stool, is something else. That's the sensory fibers. So sensory fibers are not sensation, not feeling any sensationally things throughout the course of the rectum. Stool is coming, filling up, stool is coming, filling up. And ultimately, when it reaches to the recto-anal junction where anus is attached with the rectum, at that time, these sensory fibers become active. Just like a train stops a specific station from where it can pick up these passengers and drop the passengers. So these sensory fibers are there. I'm talking about the labor pain, just explaining that how these occurs. So this is what my purpose is, to explain you that so that you can understand easily what I'm saying. In this way, sometimes people feel 3, 4, 5 times in a day. Means the sensory fibers are overactive due to some reasons. Some reasons we call diarrhea. But it is all because of that even in the small quantity of stool, they cannot hold. They are so sensitive. And person has to feel urge. He takes small food, go to urge for the stool. He takes some water, even then he feel go to. The same way, it is the oversensitivity of those fibers which are at the junction of anorectal junction. Okay, it depends on, yes, the reasons may be the food, reasons may be the toxicity what he is eating, and the reasons may be the nervous system. So all these things happen, and we feel the urge. The same way, I'm talking about the labor pains. Why labor pain starts? When when a fetus is living normally, eating normally in mother's womb and spend 280 days, why? Why he is thinking to go out, and why the mother want him to push out? What happens? It happens because its weight is increasing. Its weight is increasing, and it is pushing at the junction of the cervix and the uterus. It is pushing pressure throughout the uterus. Otherwise, if there are sensory fibers, there are sensory fibers, there are locomotory fibers, because the uterus dilates as the child develops more and more in the mother's womb. The uterus dilates, abdomen dilates. But if sensory fibers are active over there, it will be painful every time, every day, every movement. It will be, because every movement is developing, and up to 280 days the lady will feel pain. But ladies do not feel pain, because the sensory fibers over there in the uterus, it's not functioning at that time, but they are functioning at the bottom, where the body of the uterus is attached with the cervix. I told you there are three portions of the uterus. Upper portion is known as fundus, middle portion is known as body, the lower portion, which falls into the vaginal area, is known as cervix. And cervix, where joins the body of the uterus, there are sensory fibers. And those sensory fibers are having their strength, how much load they can take. How much load they can take. Sometimes there is only 6 months, and the ladies starts feeling their labor pains at 7 months, at 8 months. Even if the child is not fully developed, it's not full term, even then the lady feels pain, because of this nervous system, because of this sensory fibers. They feel that, or they're weak. In other words, you could say the weakness. In general, doctor says it's a weakness of the uterus. And if you have to explain what's the weakness of the uterus, means the nervous system. My arm is not working, suppose. My arm is not working. Muscles are not working, you can understand. But why muscles are not working? Who controls the power of the muscles? That is the nervous system. It means actually the problem, when my arm is not working, I feel my organ is paralyzed, leg or arms, whatever, or my finger is paralyzed, not working in writing. It means, though it's a function of the muscles, but it is because of the nervous system, locomotory function. But if I feel pain here, that is the sensory fibers. In this way, in the uterus, at the lower portion of the uterus, the sensory fibers are sensitive, but they are having a capacity. They are having a capacity that how much load they can take. Then, when the load of the fetus becomes to that extent, means just like we say, 7 pound to 8 pound is the normal weight of the child. And normally the sensitivity of the lower portion of the uterus starts at that point. But sometimes it starts at 6 months, 7th month, or 8th month. The labor pain starts, and the lady says it's a miscarriage, it's early time. Okay, so this thing happens because of that one. Number one, this is number one. First thing I told you, the environmental factor, that is known as the ecosystem. That wherever you do not feel sufficient. You are not satisfied with that environment. And now I am describing why they are not satisfied. The child is living in the mother's womb. Why he is not satisfied? Why he is migrating from India to Canada, Punjab to Canada, whatever? Why? It is his satisfaction. And the people of UP and Bihar, they are coming to Punjab. It's their satisfactions. The same way, the child in mother's womb has its own satisfaction, has its own things he desires. That is why he is not satisfied over there. So we are discussing the satisfying points. What are the points which play a role the labor pain starts? The first thing I told you about the nervous system. So now everything happens with the nervous system. Then nervous system pressed down by the weight of the fetus, and it pushes down. It causes pain. More weight pushes down from the body of the uterus to the cervix area. And cervix area is open. Cervix area is open into the vaginal area. But it is blocked over there. There is a constriction ring where the body of the uterus and the cervix joins. There is a constriction that blocks the fetus to fall down. That also I have told you about the decidua vera. Decidua vera forms a ring downward, which helps the uterine muscles at that come the ring of the cervico-uteral junction, and then it supports, it keeps up the child upward, not to come down, but it has its strength because all these things working under control of the nervous system. And if they are working under control of the nervous system, it means the nerves are now weak. They cannot hold the weight of the child, whether or not it has reached to the full extent of labor, full term pregnancy, that is 280 days, or it is less than that, even then. Sensitivity of the nervous system causes the labor pains, maybe before time. So, second, with this stimulation, a connection of the nervous system sends this message to the brain that there is more load, we cannot hold that. We are powerlessness. We cannot hold this load, and ultimately it's inevitable. By you cannot stop people coming from Punjab to Canada. No, you cannot stop. If ever they feel any way, they have any way to go out there, then they will not stay over there, they will go. And there is a way there is a way the brain sends the message through pitocin hormone. When the signal goes, we cannot hold the weight of the child, and that opening starts opening, and that sends the signal to the brain that there is a big pressure, we cannot hold that. And okay, brain said, no, we cannot hold this back. We cannot hold this back. If a child is bent upon, no, I will not stay here, I will not work over here, I will go to Canada or America, then he does. He goes in whatever way. Then the parents cannot stop them. The same way the body cannot stop the child to come out. And the easy way, okay, manage the things. Let him go. If he is not stopping, let him go. Manage the thing, manage his visa, give him money to buy the tickets, let him go. The same thing is done by the posterior pituitary, that produces a hormone that is known as pitocin. And with the pitocin, its function is vasoconstrictor. All the medicines, all the injections we take, even penicillin, adrenaline, anti-allergic medicines, whatever type of medicines you take, that has two type of effects on our body: vasoconstriction and vasodilation. Either they contract the vessels or the organ. Vessel means organ, you could say. They contract the vasoconstriction functions and they contract the organs. And other function is to dilate the organs. These two type of functions, every substance, every medicines, by the name of medicines, every substance which goes inside our body, just like even food we take, masale, haldi, all these things, whatever you take, turmeric, okay, ginger, this allium cepa, onions, all that, they have two type of functions on our body: vasoconstriction or vasodilators. And every action follows the reaction. If on the first place it is vasoconstrictor, on the second place it will produce vasodilator effects. Every action has equal and opposite reaction. It's nature's law. Newton has discovered that it's nature's law. The same way, the mind set up that yes, if it's not staying inside that, it's his complaint. We will come to that. That he is not having sufficient food over there. That he is not having sufficient place over there for his development. These are the secondary factors. So for the first factor, and now this is the second factor. Ecosystem is that he's not feeling suitable on this living over there. He is going out. He's trying to do that. Now the nature supports him, send the message, okay, he's not staying, let him go. And how he will say let him go? How the parents say, okay, take this money, go to embassy, take visa, and take this money and buy the ticket and go. This is what the same thing. The brain matter produces a pitocin hormone, and that pitocin hormone has, first of all, vasoconstriction effect on the uterus. Yes, one more thing. All the substances which are used as a medicine, they have their own specific affinity to work over a specific organ. Suppose you take Kirt Kumari, aloe vera, all that things. That has direct effect on the intestines. And effect, I told you, vasoconstriction, vasodilator. And you use, just, I'm coming to the, there are many more other substances which are used as a medicines. They have their effect on one or the two or the more organs, at directly on those organs, and then they causes the similar type of effect, that vasoconstriction, vasodilations. Okay, the pitocin we are talking about, say, when the brain thinks that no, if he's not staying, let him go, let him go. Okay, and then he produces pitocin hormone. He produces pitocin hormone, and function of the pitocin hormone is directly on the uterus. It does not mean that it do not affect the other organs of the body. Yes, it affects the lungs, it affects the heart, constructs them. And during labor, if you have seen a lady during labor pain, she is having palpitation, she is having anxiety, she is having breathlessness, fast hurried breathing, fast, because first of all it causes constriction, relaxation, more than the normal. So it is just to explain you that every substance had the similar type of effects, but this pitocin hormone has its effect, no doubt, on the heart and lungs as well, but the direct and major effect is on the uterus. And when it affects the uterus, then it contracts, the uterus. And wherever there is a weak point, wherever, suppose if somebody is pushing you out and there is only one door, all other places are blocked. In the room there are walls all around, but there is only one door. Where you will go? You will rush to the door. The same way, vasoconstriction effect of the pitocin hormone constricts the uterus forcibly, and then it pushes downward, or it is being pushed, because automatically there is no way out when it is pushed from upward, it will go to the way where is door. The door is downward, and the door is already blocked over there. And that is why it takes time from 12 to 16 hours for the labor pains. Why? Gradually and gradually, he has to open the door. There is darkness. There is a darkness, and you have to find out where is the lock. How you can open the lock. And there's only way the pressure. With that pressure, there is a mucus plug, and there is a decidua vera, which is coming from both sides and covering this one. And then it is pressed upon. And from the decidua vera and also the plug inside the cervix, there is a mucus, filled of mucus, that comes out with the pressure. When the pain comes, back and forth, you give pitocin injections, it gradually does the same thing. Back and forth, contraction and relaxation, contraction and relaxation. It does the same way, and ultimately that door is open. And the door is open, it shows outside to doctors, to us, that some, first of all, some mucus is coming. Though it causes pain when forcibly you are pushing the uterus, constricting the uterus. With the constriction of the uterus, yes, a lady feels pain at the height. When someone will catch my arm and he catches forcibly, I will feel pain, which is more than my strength, my capacity to bear this constriction. I will feel pain. You shake hand, you do not feel pain. But if a person is shaking hand, is catching your hand forcibly and very forcibly, with beyond your strength, yes, you will feel pain. Same thing happened in the uterus when this nature has produced the pitocin hormone. And that pitocin hormone ultimately intercurrently, just like intercurrent, current is passing through the electric wires, intercurrently push, relax, push, relax, just like we are pushing the door, and ultimately that door is opened. That door is open, and then mucus, and sometimes when the head of the fetus is fixed into that small area, that door area, that is bony part. Skull is bony part. When it is passes from that, it lacerates the membrane on the both sides, and lacerating the membrane on both sides produces blood. It brings out blood. So there will be a discharge of mucus and also of the blood, and this will be the approximately first sign we see outside. Inside, reaction has already started from the very beginning when the first pain was started, and that was very slowly. So, just like now, Trump is pushing people out, pushing people out from the America, but it's a slow process. And some people say, "Oh, I may be safe. I have this type of documents. I may be safe. I may be safe," and that effect is after a long period, after a distance of time, after a distance. But ultimately, it is activated. It's activated. It will be activated. The same type, the labor pain starts gradually, gradually. Their this distance from one pain to the other is a long distance, first of all, in the beginning. And their period of constriction to the uterus, how it presses the uterus, that's known as constriction, that is of short time. And short time, if someone constricts, just like I told you, but to constrict my arm or shake hand forcibly, I will feel pain. The same way, gradually, the first time when pain starts, it's not that much painful, but a lady feels hardness in the abdomen. Ultimately, the pain continues. Continue. We help our child to go out. We have managed everything, money, visa, and everything has been managed. And now mucus and blood is coming outside, and the door is going to be open now. So pain is increased. Pain is increased, and time limit between one pain to the other is shortened, and the time period of pain is increased. Every time it increase, every time it increase, and then continuously it pushes out, the door is fully open, and then a condition comes out that is known of show off. And that show off means when there is a water bubble comes out, that is amniotic sac in which this child was moving out in the mother's womb. There's a fill of water, that's the amniotic fluid, and child was moving in that. And along with that, it's not ruptured yet. Along with that, the head is also coming inside. And head is also coming inside, and then with the forceful pain, that bubble is ruptured. That bubble is ruptured, and a gush of water, amniotic fluid, comes out. And sometimes, if the head is a little bit large, if the cervix is not fully opened, sometimes there may be a big bleeding at that time too, which may come from the membrane of the amniotic sac as well. Bleeding may come up at that time. So then, show means the bubble of water and water bag, that's known as water bag, and also after that, the presenting part of the fetus. Presenting part of the fetus. Presenting part is that part which is first shown or which is first coming out from the mother's womb. Mostly people say that the normal position of the head comes up, and head has different position, sidewise, frontal portions, occipital portions. But if if the smallest diameter of the outcoming head is facing far outward, it's very easy. It's very easy because the small portion will dilate, then the bigger portion may come easily. And if the bigger portion will come first, it will stuck over there. The smaller portion is the backside. Okay. So in this way, all that will happen, that the show up portion, the show up portion is mostly the head, and mostly the head means the occipital area. The occipital area is the smallest portion of the head is our occipital area. If it faces comes outside, then it's a normal and easy delivery. And if it's not facing, any other portion is facing, that is a little bit of difficult delivery. And when there is a show up, water bag has burst out, and then you can see with your fingers, the expert doctor will feel with the fingers that what portion there is a gap in the backside, you can see that. Okay. So uh, if expert doctor checks at that time, then he can feel that what position is coming out of the head, if it's a cervical. Okay. And that is known as occipito-posterior position. Occipito means occiput, kutti. Posterior is the backside. Occipito-posterior. So this side means back is coming. Front is frontal and is backside. So if the back side of the head is coming first, it is the smallest diameter of the head, and it will pass easily without more pain. There is pain, but without more pain. Whereas any other position of the head is more painful because our forehead is more larger than the occipital. If the forehead delivery is coming up, it may be a little bit difficult, more painful. But if it's sidewise, too much difficult. Side is long, it's difficult. And the more and most difficult is the hip. Sometimes because of some problems in the formation of the fetus, means development of the fetus. The head has not developed normally, and the body has not structured normally. And this way, the head is lightweight. Mostly, the head is heavyweight as compared to the hip. Hip is larger, but it's a lightweight. Whereas the head is small but heavyweight, and just like you can say a big boat of the wood can float on water, but a needle, small needle of metal will dip into the water. The same way, this head, being smaller in diameter as compared to the hip of the child, it's heavy, and normally it is downward. Normally, naturally, it is downward. But because of some problems in the development of the fetus, some problem, this uh, um, head has different positions. And sometimes the head is light and is not coming downward. The hip is more heavier, it comes downward. Then that's known as breech presentation. Breech ult. Our contract is for the business. Our contract is written contract, but when you break that one, it means you breach the contract. And our contract, the contract of the child is that head should come down. But if he breach the contract, that is known as breach presentation. Oh, no, no, you are not coming normal way. Okay. So then breach presentation, when the hip is coming out, and this way, that is very difficult delivery. Very difficult delivery in this way. So we have to consider all these things, that how we are passing through, how why labor starts. This is what we are discussing. So first thing, we told you about the environmental factors. The second thing, I told you about the this hormonal factor. Okay. And then disagreement, you can say a disagreement between the uterus and the fetus. No, I cannot live here. Okay. I cannot live here. And there's less space. Okay. No, I need more space. There's less food. I need more food. Mother has a limited quantity of food which he can supply through the placenta, and mother has a limited distension of the abdomen, or the uterine muscles. And when the uterine muscles, they are tight up in the dilatation, the maximum of their strength, because there are round muscles, longitudinal muscles, and circular muscle. There are three types of muscle which bind that one. And but even then, they are dilated to the maximum extent they cannot. Now they will torn up. Now they will torn up. So that is the maximum extent which pushes the fetus to go out. No, yeah, we can no, we cannot live in one room, three, four persons. We cannot. Only we can live two persons. No, it's a space only for this one. Okay, so then you are expanding your arms, you are expanding your legs, and you are doing this and that. No, you are not allowed here. Go. The same way, the uterus is constricting now because it cannot accept the activities of the fetus at full term, because he is expanding his arms, expanding his legs, and all the way he's jumping. That is known as kicking. That is a specific term, and the medicine is used as kicking, moving, then kicking. When it comes to kicking, nobody will be at that one. No, the same way the uterus do not accept this activity, and the child do not accept that. Yeah, you will put conditions on me. No, I will not be that. The same thing initiate the pain. Same thing. Disagreement, you can say. The disagreement between the uterus and the fetus activities produces the pain. No, okay, go. Even mothers say to the children like that. Okay, because of his naughty actions, It's okay, go. The same way, the uterus feels like that whatever I can provide, which was my maximum strength, but now I cannot expend more than that. Even the abdominal muscles, they are pushing me downward. Okay, maximum. Whatever they can support, they have supported that. And you are increasing time to time, you are increasing time to time. No, it's not acceptable. Okay, go out. That's why the pains are initiated. That causes the pain because of the fullness of the uterus. In this way, the other things, that direction of the pains. I yesterday in my lecture, because today I increased the time of this English lecture because it was not yesterday. Tomorrow I will try to go in Punjabi lectures and also in Hindi lectures, so that we can cover up all these chapters. So uh, I yesterday in my lecture told you about the direction of the uterus. And when you are passing from a street, what are the turnings in the streets? You will turn likewise, and you will show up according to that one. And the child, when starts going out from the valve, and I have told you that the door portion of the uterus is dipping down into the vaginal area, and the vaginal area is from front to back, which touches the backside. Read the haddi, vertebral column, which touches the vertebral column. And then when it is pushed from upward, where you will feel pain? You will feel pain in the back. You will feel pain in the back of the origin of that one. In this way, when the child is pushed from upward downward, the upper portion is constricted, then the pain goes to the back. The body of the uterus is straight, and the upper portion of the uterus is, that is known as fundus. Upper portion of the uterus is like snake's head, just like this one, snake's head, and it is facing up, front side, to our abdomen, front side. And that is known as, the position of the uterus is anteverted. That's the normal position. Sometimes some of the forceful labors, and sometimes some other problems, illegal abortions, then sometimes the uterus changes the position. And when from the anteverted to come postverted, sometimes a very painful condition for the ladies. More pain, more pain. And until the position of the uterus is coming normal, pain is not relieved by any medication. This is a serious condition. But I'm telling you, it's a labor pain. It's a time bound pain. And the the direction of the uterus from upward to downward, it looks like it is touching the back of the vertebral column. Then when it is pushed from upward, constricted, it will goes to the pain goes to the lumbar area, the back side where you put the belt on. That area is known as lumbar area. And then you feel pain over there, and then you feel pain in the rectum area, because that the between gap that I told you, there's the sigmoid colon. Sorry, Douglas pouch. Douglas pouch is in between the rectum and the uterus in the females, and rectum and the prostate gland in the males. And this is a common place, Shamlat area, common place. It may be used by the uh, rectum if it's full of stool. It may be used if the prostate is enlarged. If it is used if there is a full term pregnancy. And most of the times, ladies during last months of the pregnancy feels constipations, because most of the position has been hold or covered, you can say, the rectum. And then there is a constipation, because that common space, Shamalat area, has been covered by these areas. So this is commonplace. God left over there may be used by either party, by the rectum or by the uterus or by the prostate, and anybody can use that one. In this way, uh, pain goes to the back and then comes to the front. So this is the direction of the pain, mostly labor pain. The ladies in the beginning starts, I have pain in the back, lak dard, lak back pain. So when the labor pain starts in the beginning, it starts with the back pain, and sometimes it confused. It is confused. It may not be a normal labor pain. There may be any back pain, any reason. She might have exerted more. She might have worked more. That's why she is having a pain in the back, and that may not be labor pain. That may be confused with that because it goes to the back. Then, by the other sign and symptoms which I am telling you, you have to compare that. Is it a normal labor pain? Is it false pain? Because in the first lecture I told you about the Broxton Hicks signs. He was a doctor, and he grouped some of the symptoms: vomiting, nausea, pain, its directions, urging for frequent urinations in the initial stage, urging for stool in the late stage. So he gives some of the points to identify that it's the normal labor pain. But when these signs are not there, sometimes it may not be a labor pain. Only backache is not a labor pain. But along with backache, if all these signs, constriction, hardness of the abdomen, and show up in the vaginal area and frequent urging in the initial stage, urging for urination. First of all, I would like to say, first of all, urging for urination in the initial stage is the exact indication of the labor pains. That we must note that one. And after that, tightening of the muscles, mostly. It's not only the abdomen, but the lady feels it is tightening here as if my uterus, as the child was moving, now it has become a round ball, constricted, constricted, hard ball like that. And then it is relaxed. And when it is hard ball like constriction, and if there is no dilatation downward, then it's more painful. Sometimes illiterate, ignorant ladies, villager dais and all that, those who are not well known to all these facts, at that time, when still your door is not open, lock is not open, and you are not going outside, but it is pushed from the backside, go out. At that time, this is known as the first stage of labor. At that conditions, sometimes they give the injections because they do not know the stages: first stage, second stage, third stage. And if she do not know about the stages, under those conditions, sometimes they put early injections of pitocin just to help the natural pitocin. Natural pitocin is produced by the brain automatically with the natural process, nervous system, with the natural process demand of the time. But we want to initiate, ignite that one, to accelerate the things fast, fast. It should be delivered fast. And then we give pitocin injections outwardly. And when we give pitocin injection outward, it make it more constriction, but the outer door is not open. It's still plugged up. Cervix and the uterus, that is still plugged up. And then under those conditions, sometimes child may die. Sometimes it may be a stillbirth. After birth, the child is died because long time he was without oxygen. Long time he was without oxygen. That's why he dies. And it is the ignorance. It's the ignorance. So that's why I'm giving these lectures to let you know, everybody, that whosoever is deployed as a doctor, as a nurse, as a midwife at the time of delivery, she must be knowledgeable to know about these stages of the labor. What are the stages, and in what stage what we have to do that. I will let you know how to manage these things. In first stage, how to manage that. In the second stage, how you manage that. In the third stage, how you manage that. In the next lectures, I will go to that. But today, our time is over for this English lecture, and I have taken 2 periods for the English and also for the Punjabi. So tomorrow we will be delivering lecture for Punjabi and Hindi. Total time period we will take to the Punjabi and Hindi lectures. This is Gurdeep Singh Sandhu, your homeopathy consultant. I am here at 7021 Village Parkway, Dublin, California, 94568. My phone number is 408-687-1899. Email address homeomedicine at yahoo.com. HOMEOMEDICINE at yahoo.com. Anytime, if ever you want to consult me for any disease, or if you want to get treated with homeopathic systematic treatments, you can call me at 408-687-1899. God bless you. We will see you tomorrow. Okay, and tomorrow it will be a Punjabi and Hindi lectures, and full time Punjabi and Hindi lectures, so that you can understand all this thing very easily, clearly. What you could not understand in this English lectures, you will understand in Punjabi and Hindi. God bless you. Thank you.